what is a doctor of internal medicine, I think for most people, or at least from the college campus, people seem to think it was everything internal.
Yeah.
It's like, what is a cardiovascular
Well,
person?
to be completely honest with you, I guess they call it internal medicine because you're looking at their labs, you're looking at what's going on inside their body. But there are kind of a big split these days between the the internal medicine doctors who want to work primarily in the hospital. And they kind of follow a program that's called the hospitalist program. And they only take care of patients in the hospital. They don't have an office other than maybe some kind of office within the hospital itself to do their notes and review things and that kind of stuff. But what I do is 100% in the office. I do not do any more hospital work, and a lot of internal medicine doctors these days are going to that. So the other way, the other type of, you can also say that I would be considered a primary care doctor. So primary care meaning I'm the first stop for most patients. If they don't know what kind of specialist to go to, they start with me. And if I can't figure it out, or if I can't run the kind of tests that they need, or treat them with the types of medicines that I can prescribe for them to fix their problems, I send them to a specialist. So, and I see it quite often where a patient will just refer themselves to the wrong kind of specialist, and then they come back to me, and I'm like, well, if you just started with me, I would have told you you don't go see an ear, nose, and throat doctor for a stomach problem or something like that. Not that they would do something like that, but a lot of people, so for example, like would go see a neurologist for something that probably they should have seen a neurosurgeon for, something like that. So, it helps them to not waste their time. And even if it's just a phone call and they, I get a message and I talk to the patient on the phone and say, well, no, this is the kind of doctor you want to see, not that kind of doctor. But typically they start with me as the primary care doctor. Most health insurances nowadays want you to have a primary care doctor. And if you don't really pick one, they'll pick one for you in most cases. And it helps. So, that's what my type of internal medicine doctor does. Now, you can go through an internal medicine residency and, like I said, end up doing primarily hospital work. And that's what a lot of folks your age want to do now. They all want that shift work kind of thing. And then some internal medicine doctors end up going into urgent care. You can't really technically do emergency room care unless you go through an emergency medicine residency.